You're listening to the Sick and Good podcast. My name is Dustin Messick. I'm a registered dietitian nutritionist and a cancer survivor.
My name is Colin Goodwin. I'm a clinical psychologist and a cancer survivor. We're promoting wellness by having discussions on screening, treatment, and recovery throughout the cancer journey.
To find a balance between sick and good.
That during the cancer process, both can be true.
The Sick and Good podcast is for educational purposes only. The podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regimen.
Dr. Tiffany Troso-Sandoval is a double board certified medical oncologist with over 25 years of experience specializing in breast and gynecologic cancers at Memorial Sloan Kettering Cancer Center in New York. Now the founder of Winning the Cancer Journey in the Second Look Oncology. She's also the host of the Empowered Patient podcast, where she spotlights conversations that transform the doctor-patient dynamic. Welcome, Dr. Troso.
Thank you so much for having me. I'm honored to be here.
Wanted to ask what made you want to be an oncologist?
Wow, digging way back. So I've always been the kind of person that liked to know people. I've always had a lot of friends, acquaintances, and I'm somewhat of an extrovert. I remember when I was a little girl, my mom would take me in the backseat of her 70 Pontiac with the red pleather seats, and we would drive to a local hospital to bring my grandmother, my mom's mom, to the hospital because she had developed cancer of her thyroid gland. And my mom would take her in and leave me in the backseat of the car, as one would do in the 70s, and would bring my grandma in and then would come back out and sit in the car with me while we waited, and was always so upset. She would cry, she would, curse, she would be so frustrated because she could never get a doctor to really spend any meaningful time with her to explain what was going on with my grandmother, what the prognosis was, what the overall plan was. And she always felt like she was pulling strings together just to figure out what the next step was. Fast forward to college, I went to Princeton and I majored in molecular biology back in 1990s. And believe it or not, at that time, a lot of the oncogenes and the DNA stuff that we're using now as part of our standard of care treatments were still just being worked out. I fell in love with molecular biology. It was really so fascinating to me. So when I went to medical school, it was almost a natural continuation to go into oncology. It was, it was the culmination of really wanting to help people that really needed and wanted my help. And the science behind it, the molecular biology that goes into oncology and oncology treatments, as well as my love of working with people one-on-one, really getting to know people and women. And it was a sort of a natural progression. And I would actually go as far as say it's a calling. It's something that I've always felt. Now that I'm here, I feel like I've always belonged here. So,
Can you define your role as a medical concierge?
So, interestingly, about a year ago, I actually retired from Memorial Sloan Kettering Cancer Center. I had my own medical problem that required me to sort of slow down a bit and step back from the sort of corporatized, high-profile academic medicine. And I started my own companies. And one of the things I had always been frustrated by in academic medicine was that there really was just not enough time to spend with the patients. And you were on a clock, you had a certain number of patients you needed to see, and there were only so many minutes and hours in a day. By becoming a concierge physician, I take on less patients and I work with them one-on-one. And I can honestly tell you that I know my patients so well in terms of what their goals are, what's important to them, what things are they looking forward to in the future, what problems are they finding while they're receiving their treatment, so that I can actually work with them so closely that I make it a completely different experience for them to have cancer and get treatment for cancer, but yet have an expert sort of in their pocket as their guide all along the way. And so being a concierge oncologist has really allowed me to be the kind of doctor I've always wanted to be, but really wasn't afforded the time or the ability to do so in the past.
That's so important, to get that one-on-one
Yeah.
time. because so many medical visits, you just feel like the clock is ticking and you're getting like, okay, 20 minutes is up, next person.
Yeah. Well, we certainly never meant to make anybody feel that way, but I can tell you for sure that it's very difficult because the person in the next room doesn't necessarily understand that the patient that you're with right now might have some acute emotional or physical problems that really need to be addressed and are not fitting into that 20 minutes. So, each I used to have 3 or 4 exam rooms that were in a row, and so I would come out of one room, take a deep breath, pick up the next chart, and go into the next room. And, unfortunately, everybody's worried about themselves, obviously, because it's an acute problem and they're getting cancer treatment. And of course, they should rightfully be worried about themselves, but don't necessarily understand what else is going on behind the scenes. And so a lot of times, you'd walk into an exam room and the patient and their family would be like visibly pissed off. Like, why am I waiting here so long? And, HIPAA reasons, and also because I just, have to remain professional. I can't say because the patient next door is actually, I just put her on hospice. The other thing I help them with is to help define how best to communicate with their physician and how to have the conversations with their physician where perhaps they're not agreeing with the particular recommendation that their physician is providing them. So I help them to really have an in-depth understanding of what they are choosing between so that they can have on point conversations with their own doctor, because one of the beauty of being a concierge medical oncologist is that I am providing second opinion. I'm providing support and a physician advocacy type of a position where the patient is learning and is becoming empowered to then work better with their own physician. So I am not providing any treatment, so to speak, but by being their support system and their concierge, I'm allowing them to get the best possible outcome from their treating physician.
You've created a role that sounds exactly like something me and my mom have talked about for years. There needs to be somebody who helps guide patients through this treatment process because it's so overwhelming to go through this. You don't know what any of the words mean the doctor's saying. So it's so great to hear that you're able to be in this space.
Yeah. The limitations are that there's only so many minutes and hours per day. And so, how many patients can I actually be the concierge for? Which is why I am also developing an online course that people will be able to join a community and learn from this course. And then I'll have one on one time, which is not really one on one, it'd be one to a group, to really ask more questions so that you can thoroughly understand the material that I'm providing. One course is based on one of my new books, and the other course is based on my other book. So the first book that I'm putting out is it's basically an oncology 101, what a patient would know and understand from the moment that something has happened. So you have an abnormal mammogram, and where do you go from there? And I walk a patient through that as an expert, but speaking to a patient, layman, exactly everything that has to happen along that trajectory for them to get their best possible outcome. And, that includes I review how to read a pathology report and what's the difference between an MRI and a PET scan and why would we use one instead of the other. I go through different types of treatments that we use, particularly for breast and gynecological cancers. I go through side effects. I go through how to discuss things with your physician. The second book is called The Empowered Patient. And that one is more of a mindset book where I am teaching patients how to best organize themselves psychologically as well as within their own stratosphere. So everybody has a million people that want to help them, and nobody knows how to help you. And nobody knows the words to use. And this book sort of walks you through organizing and systematizing your cancer care. One of the phrases I use is become the CEO of your own care. And I teach a patient how to empower themselves and how to empower others around them to help them in a strategic way.
Well, I wanted to maybe ask, has your consultative role as a medical concierge expanded? I guess another way to ask that, I know that you were board certified in breast and gynecological and cancers. Are those the particular population that you're working with, or is there an expanse in that role or responsibility?
Sure. So, how I usually answer that question is when it comes to giving a medical recommendation, a treatment recommendation, you should take chemotherapy ABC instead of DEF. I stay in my lane. I stay in breast and gynecological medical oncology, and this is what I know best and I'm an expert in. That being said, I am board certified in all of medical oncology, and theoretically, I can help guide anybody. So I've had patients, for example, that have had head and neck cancer, a male. I've had a patient that had pancreatic cancer, a male. And although I might not be specifically prescribing or recommending a certain line of treatment, I can still explain all of the other stuff that's there, right? So I can still review your PET scan. I can still review your treatment recommendations. I can still explain to you what the side effects are, what some of the other options are. We talk about genetics. There's so much to know besides just what the exact prescription for chemotherapy is. That yes, I can help anybody in the medical oncology field. Maybe not including leukemia and lymphomas. We consider those liquid tumors, and I'm not quite as attuned in those. But pretty much any solid tumor, I can help a patient guide them through their treatment as an advocate and as an expert. But coming short of just actually the prescription component of it.
Can you tell us about your public speaking engagements and the Empowered Patient podcast?
So, the Empowered Patient podcast, I just started a few months ago, and I've really, really enjoyed doing that. I've met some brilliant people, very engaging, interesting. I've learned so much. I've met people that I probably would never have spoken to otherwise. And I look to basically speak with people that are moving and shaking things in the healthcare industry, and also as it pertains to oncology. So I have spoken to medical concierge primary care physicians. I've spoken to cancer advocates. I've spoken to patient survivors that have actually also had a very big impact on how other physicians practice medicine. I say that I like to talk to the movers and shakers in my niche, and it's been actually really, really interesting and very enjoyable to do. And I've grown significantly. I can't believe it. I grew from nothing to, I think I have, I don't know, 2,500 subscribers already. So in just a couple of months. So I'm pretty excited about that. And that's without really doing much, advertising. I think it's just word of mouth and from, maybe some of my other social media outlets. My public speaking has been probably limited more to specific topics in breast cancer, for example, or specific topics in oncology. I am really looking to expand out more into being able to speak about some of the mindset things that I was telling you about before, how to empower yourself as a patient. And I think that should be very interesting. Once I'm done publishing my books, my next goal is to get a TEDx talk. And so I'll circle back with you when I get there. So
Well, that was something I wanted to ask some more questions about as well. Like you had mentioned that there's some courses that you would like to have based on your works, and wanted to see if you could just give us maybe like a sneak peek of the book that you're working on, or just some of those courses.
I have a content construct that basically looks at a cancer patient from the empowered patient as being the empowered patient as the goal. And I have a 3-tier system where I help patients to learn how to plan, participate, and prepare for their treatment. This is part of that whole mindset and organizational platform. The areas of work that people need to do is to learn how to coordinate their own care, how to learn how to have a sense of calm and control and clarity. And so by each of those pillars really help patients to develop their own system in which they are creating their best cancer journey. And one of the titles of some of the things I do is called Winning the Cancer Journey. And some people say, well, you can't, what do you mean winning? You don't win cancer. What I mean by that is that by winning the journey, you're getting your best possible outcome in the best possible manner. And so I can't ever promise a patient that I can conquer their cancer and make it go away and never come back, but I can help make it the best, most fruitful experience that it could possibly be and help you get the best possible outcome that's available to you. And so that's really where that comes from. Not sure if I answered your question or not, but yeah.
I like that it's focusing on like the journey and not like like you said, the outcome or like the destination. And it's more so about being able to have that. I think one of the qualities you had, identified as that clarity, and that calm, that ability to have maybe some emotional regulation or equanimity with the process.
Mm-hmm. And one of the basic tenets that I'm sure you've heard of before, but learn to control what you can control, because we can't control everything. And decide where and when you're going to spend your emotional energy, because that's within your control. So if you're waiting for to see the doctor or you're waiting for your CAT scan and they're 2 hours behind and you didn't eat lunch and somebody's got to pick up your daughter and you weren't supposed to be there that long, you can lose your cookies and beat up the woman at the front desk and yell and scream and get yourself all worked up, or you can manage your emotional energy and either reschedule or what have you. I guess the point is that you get to choose how you're going to manage your own emotion and your own energy, and learning to let some of the things go or understand that this is par for the course, whether you like it or not, whether it's fair or not, I think allows a patient to have more control over their own personal environment, if that makes any sense. I hate to see patients lose control over things that are really not in their control to begin with. If that makes sense.
I really loved how you said winning the cancer journey, because it's like earlier, Colin mentioned it's like, it's more about the journey and not the destination. And with cancer treatment, if you don't really know what the destination is, and there's like doctor visit after doctor visit, and from my personal experience, going to all these different medical providers became like a full-time job during my treatment. You're going like twice a week to the doctors, and you're trying to make sense of it all, and you don't there's the fear of that unknown, plus all of like the medical information that is being thrown at you when you're just like brand new to this world. You just feel kind of lost. You're like totally, for me, I was failing the cancer journey. I mean, obviously I got to my destination, but the whole journey was such a struggle to figure out how these medical systems work and how to get to that positive outcome.
Yeah, that's very common. Hopefully we can help people not have to take the pathway that way, help people make it a little bit smoother and easier so that it doesn't have to, because I'm sure in some perspectives you probably have some like a post-traumatic stress disorder from looking back at what went on, right? And then you carry that with you for the rest of your life. And so I can't promise that you're going to walk away from cancer and be completely unscathed from it, but perhaps it doesn't have to be quite as difficult as it was for you, for example.
Yeah, and I love the part where you talked about mindset, because I think what really carried me through all of this was that the whole time, my mom and my brother, my support system, is we were like, we just have to make a lot of jokes. Like we have to make this humorous. Like, and we had this joke about the MRI. You get an MRI machine and it's like this loud noise that's like, and you're in this like really narrow cavity. Like you go in, they put you in, and the machine is like moo, moo, wee, and you're like, and you're thinking, how long am I going to be sitting in this narrow cavity? And it's like 45 minutes of just woo, 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 and you're like, what is that?
Wait, you forgot about the bop, bop. There's that part too.
Yeah.
When they're lining the magnets, right?
Yeah. So yeah, we made so many jokes that we were like, we could do stand up. We could do a stand up comedy for cancer survivors going through the treatment journey.
I like that.
That's going to be the audio clip for this episode. Just the MRI impressions right there. One thing you had shared is that there was, when you were at Memorial Sloan Kettering, a process of like having, 3 or 4 patients in a room, and like there was times when it was really hard to manage that, and you had to like kind of have that reset. I was curious, like, how does that look different for you as the medical concierge, and is there a different reset that you have now?
I mean, right now it's a completely different world, right? So I may only see 1 or 2 patients in an entire day. I'm not taking very many patients. I'm just taking, a few handful at a time that I can take really good care of. So it's very different. I wouldn't book. I try not to book patients back to back at this point either, so that I can actually help reset myself so that I'm the best. I can come with the best energy and intellect as possible. So I might have a patient in the morning, then maybe I go to Pilates and I have lunch and another cup of coffee, and then I have another patient, or I do a podcast or something. But it's the beauty of entrepreneurship, is that I set the schedule now. I'm in charge. And but that being said, I still have the burning desire, passion to take care of patients, right? And so even though I left clinical medicine, I haven't left my passion, and I haven't left my journey that I have described in terms of helping patients get their best possible outcome. And so I am still very, very committed to that, and I'm excited to be able to do it on my own terms. Luckily, I'm fortunate in that I have some other means to make some money at this point, because if you can imagine, if you're only taking a couple of patients at a time, that's not probably enough to support my 2 kids in college and one in medical school. So I I've actually started doing some other things that help sort of pay the bills, so that I have the luxury to be able to take care of just a few patients and to be creating these books and these online courses. And so it's a little bit of a balancing act to make it all happen. And every once in a while I have to whip my husband like that, so he goes back to the operating room and does a few more surgeries to pay for our car insurance or something. But no, I'm just kidding. But it's a teamwork between he and I, and he's been extremely supportive of me, and it's been really, I couldn't have done it without him. So thank you, honey.
It almost sounds like a comparing like your role at Memorial Sloan Kettering and your role now is like apples and orange juice. Like they're completely different, and that there is more of that flexibility with your new role.
And being in touch with life, you know. I used to look out in between patients, I would look out the window and like just long to go outside and just take a walk for a couple of minutes. And, maybe once every 3 weeks, I would get a chance to do that. But usually, we're could barely had time to go to the bathroom or take a bite of the turkey sandwich on my desk in the back room. But now I finished seeing a patient. We finished filming a podcast. I go and I sit in the backyard and I pet my cat and I throw the ball for my dog. And it's like a whole other world right now. And I think that it helps me be a better person and a better doctor, because I feel more fulfilled, or more like I'm participating in the world around me. Whereas before I felt like I was in this like fluorescent light tomb that I was working in.
Hmm. It sounds like the pace is quite different, but
Yeah.
that it's affected your outlook and your mindset, or just had more opportunities to be mindful, to then be connected with
Mm,
what you're doing, to then show up how you want to show up.
hmm. Yeah. Agree. Agree.
Being outside is really powerful. I think, like near the end of one of my hospital stays, that was like a whole month long. I just looked out the window and I was like, wow, there's a whole world outside. I can't wait to get out there.
So what do you think about the whole credence of like your feet need to touch the ground outside, preferably without shoes? Have you heard about that? Like to be grounded outside?
Yeah, I love that. I like to go to the beach and just like one of my physical therapists actually mentioned this. I was having a lot of pain in my feet, side effect of the chemo that's kind of like kept stayed with me for the last 18 years. I'm in remission. And he's like, just go to the beach, put your feet in the water, like ground yourself. And I remember it being like really helpful. I would always feel this like, I almost felt like the ocean water was washing away all my worries. Is there a beach you go to in New York?
I love the beach. Yeah, I live on Long Island, and actually, we have some of the most beautiful beaches in the world. Believe it or not, I'm at Atlantic Beach, which is maybe 30, 40 minutes outside of Manhattan. Jones Beach, a lot of people have heard of. It's a big national state park beach, but it very fine white sand. The ocean is blue, green, brownish. It's not beautiful. It's not Caribbean looking, but the sand itself and the actual ocean breeze and the waves. I could just sit there. I could sit at the beach forever. In fact, I told my husband when I'm gone, that's where I want to be laid, somewhere at the beach.
Yeah, during my chemo treatment, my brother was like, we have to spend time outside. I read all these studies that were saying that it's really good to be outside. So he would force me to go outside. And when you're doing chemo, you're so tired that you're like, I just want to be in my bed. When can we go home? No, this is really good. Stare at the trees. Take in the breeze. And yeah, it's really powerful. There's like tree bathing. There's all kinds of research out there around like the power of just grounding and connecting to the earth. And some people believe it helps us reset our circadian rhythms to like the earth. I don't know if that's true or not, but it's kind of an interesting
It is
concept.
an interesting concept.
I think my happy place during my treatment, while I was at the City of Hope for my bone marrow transplant, was just the Japanese garden. Going over and being able to see the koi pond, and then just sitting there and breathing it all in, being able to then really have that be a place for reflection and calm and peace. You know, one thing I was reflecting on is how you shared just your motivation for wanting to be an oncologist was shaped by your personal experience with going to the hospital with your mom and sitting in the back of the seat while your mom went in. And like, I was just thinking like, wow, I think so much can be said about just getting out of that back seat for you, you know, like being able to then be a part of that importance. And my, like, as a psychologist, I'm like, oh gosh, like I wonder what you would say to that little girl in the back seat now, like that you've had this career at Memorial Sloan Kettering and that you've had this shift in uh, um, your role as a medical concierge.
Hmm. Yeah, I think that's interesting because I never looked at that analogy with me being in the back seat and wanting to get into the driver's seat. But the way what I had always thought about it when I reflected on it was the fact that I just knew I never wanted to be the kind of doctor that would make someone like my mother cry. I wanted to be the sense of support and assistance and the way to getting better without the frustration and the sadness and difficulty of getting the information that they need and the pathway forward. So that was really how I thought about it. But that's very interesting. I had to get out of the back seat.
Well, it's almost getting out of the car and into the exam room,
Yeah.
like having that really shift in that perspective of, my thought is like, man, that must have felt really confining and like just feeling powerless
Mm.
to then go to a place of, like you do with your podcast, of that empowerment.
Mm-hmm. Mm-hmm. Yeah. Um, in terms of the empowerment thing, I don't think I've talked about yet my goals of really helping patients to learn how to put themselves first. So one of the most important things I try to teach patients is that you need to put yourself first. And what do I mean by that? So an analogy an example I have a patient that comes in my office, say, and I saw this umpteen times while I was in practice where, she's maybe 65 years old and she comes in with her 40-year-old daughter and they have a granddaughter, and grandma, who's my patient, is the one that usually watches the daughter's kids on Tuesday and Thursday, what have you. And the patient herself would actually avoid getting treatment on certain days or would reschedule CAT scans or what have you because it was her putting herself in the caretaker role to help her daughter and watch the grandkids so that the daughter could go to her job as a physical therapist or what have you. And so many times I've had to reorient a patient and say, look, you have cancer. We're battling, an extremely difficult foe right now. And at this point in time, you come first. And I would actually, take a prescription pad and write on it, you come first. Put you first. And I would write that out and I would hand it to them and I said, put this on your refrigerator to remind you and the rest of your family that, if no other time in your life, right now, you are the priority. Somebody else can watch the grandkids on Tuesdays and Thursdays if you have to get your chemotherapy on Thursday. You're not going to reschedule your treatment because what have you. And that's only one example. I mean, there are patients that, well, no, I can't get treatment this week because I have a big report due at work on Friday and nobody else can do it. And, I have to be there and whatever. Or, they have another family member that's ill that they're taking care of the other family member, even though this one has cancer. There's almost always somebody else that can step in and help you, which goes back to when I was telling you about being the CEO of your care. I help patients to create their support network and match the jobs with the temperaments of the people in their life. That makes sense. So if you have a patient whose best friend is like this gregarious person who, wants everybody to help, wants to help and doesn't know how to help, give her a job. Figure out which job she'd be best suited for. Maybe her job is to help organize everybody else. You could be the bus driver and you get everybody else on the bus in the right seat. The patient gets very nervous or anxious is not probably the right one to bring with you to your treatment, to sit in the chemo room with you. You don't want nervous Nellie fidgeting and, jumping up and grabbing the nurse every 2 seconds. The one that is, very organized, she's a teacher, she takes notes, she listens, she knows how to organize her thoughts and asks, pointed questions. She's probably the right guy to bring with you to the doctor's visits, right? And so there are all these personalities and people in your life that really want to help you. And there's actually a method to having them help you in the best possible way. Isn't that interesting?
Very, actually. Like a lot of people don't think about, first off, taking care of themselves. People have a hard time with that. They want to take care of everybody else and forget about themselves. Yeah, I have a lot of clients that are like, I don't have any time for myself, Dustin. And I'm like, but like, this is your time where you got to focus on yourself. How can you help them if your battery is on empty? And also just thinking about those like logistics of like the different people like in your life that are going to be good for different roles in your support system.
Yep. So those are all things that are in my second book, The Empowered Patient, Put You First is the name of that book. To be announced.
I like that you're giving them permission, because I think sometimes that's needed to then have that ability to prioritize. It needs to be then okayed or sanctioned, by this authoritative figure. And something that came to mind is the way that you were talking about just like finding the right person for the right job or the right temperament to then be that support. Something that is talked about in the book Mind Over Medicine is like the healing roundtable, like having the patient really be that King Arthur, if you will, and then having others around to then have that sense of purpose, and that it's not that one person is then more important in that journey than others, that just that there's that sense of I guess egalitarianism. Just wanted to then point that out. That I think that's another nice way of putting it, is like that healing roundtable.
Yeah, no, that's another really great analogy for sure. I look at it more hierarchical, where the patient is, and then you have is the president, the CEO, and then you have your supporting characters underneath in a cascade. But yeah, I mean, you can also, I guess, make it more egalitarian and put it at a round table as well.
I like that approach as well. Like just like having that visual. I think of like the pyramid. Like that classical, just hierarchical, then structured, then just really placing that importance on the patient's perspective and what they want, and being able to then help them then prioritize that in a way that feels good for them.
I was curious if there was any like public speaking engagements that you had where it was just like a really memorable talk. There was like something in particular you shared that, you felt was very profound or was maybe even your favorite.
When I explain to patients how to organize themselves when they go to a doctor's visit, and the concept of your Bible, your cancer Bible, which
Yeah.
is a binder that you create with all of the most important things in your cancer care in your own binder that you bring with you wherever you go. And because I do a whole webinar on how to make this binder. And I mean, I can tell you stories about where I've done this for patients in my clinic when I was at Sloan. The patient comes in with a shopping bag of like a zillion pieces of paper that every time they gather them, they stick them into the bag. And then, even though we have these electronic medical records, sometimes it's not easy to find things in those records. And so, if the patient goes to the hospital and is there for 4 days, and my office requests the hospital records, somebody over there hits print and they print out every single page in that record. And it's not tabbed and it's not indexed. And the only way to find the CAT scan that he had done on Thursday is to page through all of those pages. So you can imagine that if a patient actually had their CAT scan printed out and in their Bible and could just hand it to you, how empowering that is to them and to you as a physician, how helpful that is, right? Anyway, so this patient, for example, comes in with a shopping bag of papers, and I ask for something because I don't have it, and they start, the papers are flying, and the daughter's holding some, and the mother's yelling at the husband because why are you a mess, and there's papers on the floor, or whatever. Give me the papers. Can I have that? Let me have let me have your shopping bag. Do me a favor, run to Staples, get me a 2-inch binder, get me some of those sheets protective sheets, get me some dividers and a 3-hole punch and bring it back. I've never seen that. I've got to go. Maybe that's a good clip for me to look at. So yeah. So I mean, my nurse and I, during our lunch period, so to speak, went into the back office and just sorted and organized all of the papers in a meaningful way. Hole punched them, labeled them, put them into the binder, handed this binder back to this gentleman, and he literally started to cry. I mean, nobody had ever thought to help him on that basic level, giving him empowerment and control over something that didn't seem like it was important, but actually made an enormous difference in terms of their trust of me, their trust of the system, and their ability to own their own treatment at this point.
Yeah, you want to avoid that scene from Harry Potter where he's getting invited to Hogwarts, like you're just getting completely overwhelmed by paper. That must have been so symbolic just to have that sense that there was organization amongst the chaos.
Right. Right.
And that's really helpful too, because, when you have it all written down and you're able to hand it to the physician or whoever is in your care team, you don't have to go through that emotional roller coaster of telling your story to every single medical provider that you talk to. You're like, here's my care summary.
Well, we wanted to thank you for being a guest on our podcast and really sharing that unique role that you've created in that space. And just wanted to thank you for the care that you have for your patients. I really do see that you really have put an emphasis on having them have that structure and having them have those opportunities to evaluate their priorities in a supportive environment.
Thank you. Yeah. I'm loving my new pathway, and I really feel that in some ways I'm helping even more patients than I was before, because I can reach patients farther than I can in just 20, 25 slots in my office a day. So Thank you for having me and letting me explain to your constituents all the things that I have planned and how I plan to help everyone, and hopefully get it out there.
Thank you for being on our podcast. It's been a really great pleasure to speak with you, Dr. Troso.
Thank you, as you as well. I loved hearing your perspectives. Appreciate it.
Our podcast will discuss topics related to cancer treatment and the recovery process, including diagnosis, family support, resources, medications, and nutrition. We aspire to have conversations pertinent and relevant to the cancer journey. Thank you for listening to the Sick and Good podcast. We'd like to invite you to connect with us on our social media at Instagram and Facebook accounts. We're also happy to share that we have launched the Sick and Good podcast website, sickandgood.com. This website is a place to read our bios, subscribe to the podcast, listen to full episodes, or read full transcripts, and contact us with your questions or comments. We care about your listener experience and would love to hear from you to keep the conversation going on the topics of cancer and wellness.